Well, hello all. This is like to welcome you to another edition of Virtual Thursday. My name is Mark McKleroy, go by Mac. I'm the training manager with emergency reporting, and we're going to be covering N3 settings and medical billing, and then getting through I think the time will allow, we should be able to run through a PCR with everybody. First, I would like to go ahead and introduce who we have on today. We've got our presenters. Of course, I'll be here. Alan Miller, he's one of our regional trainers. He's in Ohio. Todd Lambert's regional trainer also. He is in Oklahoma. Lindsey, she's a support extraordinaire. I totally agree with that. And she'll be covering the medical billing portion with you. And then also Sue is one of our product owners, and she's over the NEMSIS 3 and all about as far as the backside and helping, and she has been a strong component for all the trainers and also our customers trying to get N3 working and getting the states green and getting things turned on and where we can work with it out in the field. Okay, Virtual Thursdays, remember, they're always free. We have them 2 times a month on the first and third Thursdays at 1100 hours or 11 a.m. Pacific, or 2 p.m. Eastern. Latest and greatest system reports with Luke is coming up.
Yep, that's going to be June 21st. Sorry, I forgot to put the date in there.
June 21st. He's going to be doing that, so that's going to be great. He's actually a product owner now of our reports module, and all the reports that are getting done, they're doing an excellent job getting on top of that and trying to get those rolling out. And then, of course, we have the online training. We've got 3-hour blocks you can purchase. Topic and material is whatever you need to be covered at that time. We'll get you a trainer online, and you'll have 3 hours with them, and you can bring whoever you want to get on that. And then we also offer on-site trainings, anywhere from 1 to 4 or 5 days, whatever your needs may be there. And there again, we do have some agendas that we can put out, but you know, it's really up to that individual department what they want to cover during that time. And then, of course, our regional training academies. We've got one coming up here in just a few weeks. It's Charlotte. It's sold out, so can't get tickets for that one anymore. But we have one in August, the 21st and 23rd through the 23rd in Denver, Colorado. And then the other 2 that are coming up is September 11th through the 13th in San Antonio. And then October, we've got our last one for this year will be October 2nd through the 4th in Oklahoma City, Oklahoma, right in Todd's back door. And then the picture you see here, I believe, was the Seattle show that we just had a week or 2 ago. I believe.
Oh, no, I think that's Austin, actually.
Is it Austin? Okay.
Yeah, from last year.
That's right. That's the one that I was there, but I was teaching in another room and missed the photo. But anyway. Well, all right. If we're ready, I guess I will turn it over to Alan. Alan, thank you so much. And anybody has any questions, please reach out. You can look for us up on our marketing site, which is emergencyreporting.com, and find all our information and get in touch with it if need be. Thank you so much. Alan, go ahead, sir.
Thank you, sir. Appreciate it. All right. So like Max said, today we're going to be running through NEMSIS 3 settings, medical billing, which Lindsey, who's the expert in that field, is going to talk about that. And then we will, if we have time, run into a PCR. First of all, if everybody who's online here, if you would just throw in the questions area, just type in your state, maybe a state and then a yes, no, whether or not you're live with NEMSIS 3 or not. I just kind of want to get an idea of where we're at and who we've got on board and online with us today. So first off, we'll start off with this. NEMSIS 3 is, as Sue knows, an extremely complex endeavor for both the customer, for ER, for everybody. So bear with us, if there's issues or hiccups that you're having as you've gotten going live, bear with us. We're continually, Sue and her team is continuously improving and building how our system works with NEMSIS 3. And then I also want to mention that when you switch to NEMSIS 3, you do get an hour of online training, which basically we go over what we go over here, as well as the PCR, and we help you get set up and make sure that you're good to go. So if you do need that, make sure you reach out, and we'll get you taken care of. So it looks like here we've got Michigan, Ohio, Pennsylvania, Utah. As you know, you guys are very strict. North Carolina, very strict. We got in Arizona, and it looks like Matt Pellerin, looks like you're the only one who is not live with NEMSIS 3. Well, we also have Matt Epperson out of Kansas who's using First PCR, which big news there, First PCR. You do have the ability to use forms now, so that's great. And then Arkansas. Jeremy, are you live yet? Let me make sure. Yes, he is live. Okay, so looks like everybody is pretty much live. So you all have the settings, and everything is going to look familiar to you. So first off, we're going to jump down into administration. All right, so I'm going to go down the left side here. We'll cover destinations, patient forms, required fields and customizations, and then we'll touch on apparatus list as well as the personnel list. Okay, and then we'll touch on EMS agency settings. So first off, destinations. This account is actually Mac's training account, so it's based out of Alabama, one of our most strict states. So it's a good account to use and practice in. So I'm going to jump into ABC Hospital here. So when you go live, which you guys are, the one thing you'll need to note is the NEMSIS 3 destination type. Make sure that you got that filled in there. It does not transfer over from NEMSIS 2. It is actually a different list. So you'll notice assisted living. It's a different looking list. So that's why it doesn't transfer over. Even though it's not red, make sure you put in county, because states are requiring county to be submitted when you submit a PCR. So if you have it entered in here, your personnel in the field will not have to enter it into the PCR. Then we have hospital designations. So make sure that you select the appropriate designations for each hospital. And then zone, which you can select or not select. So that's destination list, pretty simple. Just make sure you have type in your agency code, and then put in your state agency code here from the list that is provided to you within ER. And I will note that if you do have a new hospital that's added, built in your area that you're going to start going to, and it's not in this list, just go ahead and give us a call or send a support ticket, and we'll get it added to the list so that you can select it. So that's destination list.
Alan, if I may, while you're changing over there, I want to just let everybody know that even if you're already live, if you're having some problems or your guys are saying, well, we're having to fill this out and it should be this, please review what we're showing you today to make sure that you have all these settings correct, because it will make the end user, when they're doing the PCR, easier. So and help fill out things for you. Okay.
Definitely. Thanks, Mac. And that's one of the big things is that, a lot of this stuff that you fill in the back end can help your users in the field and automatically, fill out areas of the PCR form when they're filling it out in the field, saving them time, saving you money. Maybe medics are getting turned around quicker, allowing you to not bring in mutual aid or, a secondary medic going out, whatever it may be. So thanks. All right, patient forms. And like I said, this is big for First PCR now, because you do have access to this if you are a First PCR user. So you will be able to create a form. As you can see, Mac's got quite a few forms built out in here, and they've got them all active. This is also new, modified by and last updated. So they added in these fields so that, let's see here, if I go in and I'm going to say changes, changed, and I'll select that, and I'll select this. So I'm just going to change it. So it's now going to show me that now that these fields have been added, that I modified it and when I modified it. So that'll is good for you folks in the administration as well. All right, so I can either click Add Form or edit a current one. I'm going to go ahead and just edit a current one since it already has all the verbiage in there. Excuse me. All right, we'll create a name for the form content. So this is where you're going to put all the legal jargon that your lawyer wants you to have in your form. So you go through and put that in there. Your reasons. So this is going to be why do you need this form. So this is a HIPAA form, so it's going to be a HIPAA acknowledgement and release. Maybe you're doing a controlled substance administration or waste form, airway verification, whatever it may be. You have numerous different options and as well as others, so you can do as forms for whatever you need. And then disposition. So this is when this form is going to be required. If you do not select a disposition, the form will never be required. However, if it is active, you can use it. So if you are going to do, let's see here, maybe not a refusal of care, but maybe a refusal of treatment. So let's say, we'll say this is an other. Actually, we'll go ahead and do this. I'll add a new form. Refusal of treatment. I don't want a needle in my arm. Oh, you're not a doctor. Now, that probably looks familiar to some people. So we're going to say this is an other thing because they are refusing a treatment. So if I don't select a disposition, let's see here. So let's say, well, maybe I have to select. I was thinking I didn't have to select one.
It's a requirement. You have to select at least one.
Yeah, I was thinking I didn't. I'm sorry, I was covered up there. So let's say we can use this still. If I want to have it in a circumstance where I'm going to treat and transport somebody, but they're refusing to have an IV, I can just select that, but it is going to be make it required on every call. So status, active, inactive. So obviously active is going to be used in the report, and then signature requirements. So this is who is going to be required to sign it. Patient, and I want my patient and my crew and maybe another witness. So we'll be able to show you that in the report. When they select treated and transported by the unit, this form will be required to be used. So that is forms. Go back to my administration again. And we're going to jump into required fields and customizations. I'm going to click next through there so I can get that to go away. Required fields and customizations. So this is going to be one of the big areas that you're going to need to spend some time in. General customizations, basic page, those are all going to look the same. And then we have our NEMSIS 3 customizations. So enable frequent flyer. When I click that, it's going to give me my legal jargon and acknowledgement that I'm going to be bringing up past patient data. So I'm going to click enable. I have collect not values, enable N3 state submission warnings, and enable option to pre-fill normal exam values. And when you click this one to pre-fill normal exam values, you have the option of selecting which ones you want to pre-fill down below. So you can select just a certain number of ones, or you can select all of them if you'd like. If you pre-fill as normal, that does not mean that you cannot go back and change it. So if I'm in the report, I can go ahead and say pre-fill as normal, but maybe the mental status assessment was not normal, so I can go back and change that if I need to. ICD-10 codes, as of now, we recommend just leave that list alone and to not modify them. So just forget that that's there right now. Protocol codes. So these are the protocol codes that's going to give you the ability to select when you're in the PCR. You can select the protocol codes that you may have or may not have, or you can not select any. These codes are, all it is going to do is going to be another area where you can record that you followed a protocol. It does not list the exact protocol, what the exact protocol is. So for cardiac arrest asystole, it's not going to list, monitor, epi, atropine, that kind of stuff, IV, fluids. It's not going to list what the protocol is. It's just going to record the fact that you followed the cardiac arrest asystole protocol. All right, medication and procedure configuration. This is going to be the big one. When you get in here, we'll take a look at the advanced EMT. Don't want to change too much here in Max, but as you can see, right now he's got all the medications listed. So when a user goes in to select a medication, they're going to have to sort through all of these medications to get what they want. So what we can do is hit none and then go back through and select just the medications that the advanced EMT is able to give in their protocol. I'm just going to select some. So now, when I close this out, when an advanced EMT goes in to create a report, they will only have the certain medications that are in their protocol in the PCR and able to select. And the same thing goes for procedures. These are listed and sorted by category. And so you can go through and, if we're not doing chest tube maintenance or insertion, we can unselect those. Same deal all the way through. Okay, odometer readings. In the billing section of the PCR, you do have the ability to require odometer readings, and you can select the dispositions for which ones you're going to require them on. It's the same as within forms. And then you can also put in a maximum allowable transport miles to prevent false reports or just mistypes. And then we have medical billing. I can require medical billing never when a patient is transported, on all patients, and then I can add in my districts. So now that I've added in District 1 and District 2, if the user goes in, they'll be able to select from those two districts what they want to select or need to select. And then the box that says patient resides in service area, you can require that to be checked yes or no by clicking that. And that is the required fields of customizations. Do we have any questions so far, Todd, that we need to talk about?
No, I don't think so. We just had one question about NEMSIS 3 from Erica, and I answered that one. I think we're good.
Okay. Good. All right, so let's move on to, let's talk about apparatus and personnel list real quick, and then we'll get into agency settings. So same deal as in the destination. We're going to go back into our apparatus list and make sure that we put in the NEMSIS 3 vehicle type, transport type, primary role, and level of care. So those are what we're going to make sure that we select. And then this is a crew, the crew tab. You might have noticed that and wondered what that's about. And that is a demographics item. This is a state-by-state requirement. Some states require this to be filled out, some do not. So I say it's a best bet to fill it out. So what you're basically looking at is, by each certification. So we've got paramedic, advanced EMT, and we could, select regular EMT here. On a normal 911 response, how many EMTs do I have in my ambulance? So maybe it's maybe I run a 1 paramedic, 1 EMT service, so I could put 1, and it's probably going to be 1 for each of them. And that just sends out demographics to the state. The same deal goes for annual mileage. That's where you can record the annual mileage for each vehicle and ambulance, and that's another demographics area. Back to admin, and let's go into personnel list. So now, let's look at me here. when I go into certifications, yep, and I do have 2009 paramedic. The new thing with NEMSIS is they call the NEMSIS certification something different. So before I could have had these EMS certifications. Let's see, we'll go back here and go into certification settings and see what Mac has set up. So we have NEMSIS certifications under certification types. Then he's got EMS certifications here. You may have had EMT listed under EMS certifications before, and that may be what you have currently. But when you go to NEMSIS 3, you will have to select these pre-filled out NEMSIS 3 certification types and make sure that everybody has the correct one added. That will play a big part when you go into the PCR and the person clicks that they were on the call. It'll pre-fill their certification and then narrow down their medications and procedures. So that's personnel list. So that's all those settings. So let's jump into EMS agency settings before I hand it over to Lindsey. All right, so EMS agency settings. Once again, this is, some states require this. Most states require this, excuse me. Some states require, every exact thing to be filled out perfectly. Others are a little less strict. But best bet is to go through and fill it all out and make sure everything is good, so that there's nothing to worry about. So you've got your primary type, others type, EMS agency, your capabilities, patient monitoring capabilities, your level of service, organizational type. I'm not going to read through all of these because I know that you all can read. National provider IDs, EMD vendors, and some of this stuff, let's see, like dispatch center name. I know that New Jersey and Oregon are very strict that those are just the two off the top of my head, are very strict that these are in there and selected. Census tracts, we give you an option, an ability to go out to the NEMSIS site to find your census tract. So there's a great tool there to find your census tract, and then as well as your zip codes. So that's agency settings, and we got agency contacts. So add in all your contacts that are necessary. These are the different people that they ask for. So if you have them, put them in there. Your medical director, what, if he's compensated or not, he or she's compensated or not, what their degree's in, all their information. And then add in, if you need to add in more, click new. It'll create a new contact. EMS statistics. So again, this is where you can send out demographics to the state about your primary service area, how many calls you're running, and so on year by year if they are requiring that information. All right, so that is the settings in a quick and dirty rundown. Is there any questions out there? Did I miss anything, Todd?
Real quick, we have a couple questions about the certifications. The first one comes from Edward. It says, how do you separate national EMS certs versus state certs? And then Brian has a question about a way to mirror certification settings like your test account rather than having to create them all from scratch. I think these are all kind of tied together. When you're doing your certification settings and you convert to N3, those NEMSIS certification settings are already going to be built in there for you, and those should be mirrored with your state requirements, and you shouldn't have to build those. I think that's going to answer both Ed and Brian's question. When you convert to NEMSIS 3, those NEMSIS certifications will automatically be built in there in the system for you. You just have to make sure that you line those up with your personnel to meet their actual certification level, whether it be EMR, EMT, paramedic, whatever it may be. And again, that links to other parts of the system in N3.
And as far as Ed, as far as your question, I would recommend that with the NEMSIS, you follow the NEMSIS certifications. So I'll go back into certification settings here. So with the NEMSIS certifications that are going to be pre-built into the system, As you can see, you can't delete them, you can't edit them over here. Those I would follow and fill out and match your state certifications. And then if you have guys or ladies that have national registry but don't necessarily everybody, I would create a new, I would do what Mac has done here and have EMS certifications. And then within EMS certifications, so let's see. Within EMS certifications, I would create a new certification and call it something like that, so that you can keep track of it that way versus versus the NEMSIS certifications, because the PCR is going to pull that information out of the NEMSIS certifications only, if that makes sense. Hopefully that makes sense.
Yeah, and I understand kind of what Ed's asking too. Being from Oklahoma, Ed, I understand state certifications mirror national registry, and you'll notice the NEMSIS certifications here don't identify as national registry. They're just NEMSIS certifications for a linking purpose but in our system. So most of your people, if they're state certified, they've met the 2009 criteria, and so again, that should still work for you.
Yeah,
Brian, I'm not sure I understand your question as far as NEMSIS 3 for fire other certs. Give me a little more clarification on your question, Brian.
and if I jump in real quick, I'm fixing to have to run, but what we're talking about, and the reason I have mine set up that way, and you probably remember everybody that like Todd was just mentioning, a few years back, most of our states went out and they said, okay, you have to change to this 2009 licensure. And that's where that is coming from. And most states done that. Some of them might not have followed that. So you would just change them over to show the 09, because in the system, that's the only thing N3 is pulling. So if you have them under some other EMS certification, it's not going to pull that, and then you're going to get a problem back from the state. Okay. So don't, you like Tom mentioned, Tom, I didn't realize you was on here. I'm sorry, sir, or Steele. I tried to promote you, but it wouldn't work. But anyway, yeah, that's the thing. It's one of those that, it depends on what you want to call it. You can call it state or national. But in those specific, for it to pull to N3, it has to be one of those that the NEMSIS system sent you, that you got with that when you upgraded or went to N3. Okay, others will not pull there. All right.
One of the other items I wanted to add in, because I know we do have some New Jersey folks, and I know that New Jersey requires this. State EMS ID right here on the personnel list, they require that to be filled out. So that gets sent, and they don't even, I don't know if they even look at the names, but they look at the state EMS ID when the report is sent off to the state. So make sure that you have that filled out. Okay. All right. I am going to bring up a different account here so that I can pass this over to Lindsey.
Have the dispatch number. You can add but if you have,
Give Lindsey my mouse so that she can play on my computer, and I'm going to mute myself so I won't be able to answer questions.
is it the one in? No. The one ending in 6968.
All right, I guess it's me. All right, so I will just be doing a quick overview of what we are able to do or how to export your medical billing. So far, there's 3 different ways right now that we export. We'll do a secure FTP, which will export your file directly to the medical biller. You can do a file download, which will download it to your computer and you can upload it to your biller's account, or you can give them a login and they can just come in and get the file for you, depending on how your biller works, because we can't do the secure FTP with everybody. There's a process to that. We have to do a lot of testing. Some billers can't take our data. A lot of them haven't updated to NEMSIS 3 yet, so they can't take NEMSIS 3 from us. So let's go into the settings on how it will look on your account. There are 3 different options. You can have a PDF, which a PDF is literally the print page that you would print out of a PCR. Some of the billers bill off of that. You also can do the XML file that will contain pretty much the data inside the XML, which is more data that a computer is going to read. And then you can include files, which will include all the pictures out of your PCRs. Each biller wants it differently. This is more going to be us and your biller talking about this. You guys won't have to mess with these much, but these are just the options if you guys are curious on them. And a lot of the billers only want treated and transported, but here's your options on what will be sent over to them. We can do export it on review right away. When you review the call, we can export it daily or weekly. This depends right now also on a file size. If you're wanting all of this stuff to be exported, then you have to only do it on incident review right now. It won't be a weekly basis because the files are like over 100 gigabytes. They're ginormous. This button, if you're ever in here, do not ever deselect this. This prevents a file from ever being generated and exported anywhere, so don't ever deselect that no matter what. Outside of that, there's not much you guys will ever have to do in here other than maybe changing the frequency, but definitely talk to your biller or us before you change anything on this page. And then export history. Anytime there's something exported and you're curious on what it contained, you can do a receipt. And this is not going to show anything probably because it's a test account and I don't think we actually export. Oh, there we go. So it would say down here that it was successful when it was sent, or it was false. If it's a direct download, it's going to say false because it never exported anywhere. But it'll show who and what was exported. And you can do the download here, and or you can download it from here. If for any reason the biller comes back and says, hey, we had an error in this call, you can hit reset for medical billing, go in, fix the call, and then resend it. And the ways that you can resend it. You can just type in the incident number here and hit generate export, or usually if you reauthorize one, it'll be right here. It says need to have one file to be exported. So you can do it or based off the PCR number. Outside of that, that's kind of the crash course. I don't know if anybody has any questions on that.
Not seeing any questions in the question window.
Yeah, a lot of it will just be between us and the biller at first, and if they have any questions, usually a biller will talk to us, but it's not a guarantee that we will be able to work with any of the billers, just because there's different data that they're expecting sometimes, but we will try our hardest.
All right, awesome. So we good, Todd? Any questions?
So far, I think we're good.
Okay, well then let's jump into a report. So I'm going to take my mouse back here.
Okay, we just got a quick question from Brian. Is there a way to set up billing outside of medical, for example, cost recovery for fire and rescue?
So as of now, there is not. I don't know if that's something that's been talked about well, Mac's probably gone in his meeting now. But I don't know if Sue can, if she has any knowledge of that, if that's been talked about or not.
I don't have any information on that, but I can find out
Okay.
as far as
Yeah,
billing
that'd be,
for non-EMS related calls.
yeah, that'd be great. So as of now, there's not a way, but you know, nothing's ever out of the question for the future and where the system goes. So we can ask and see what the answer is. So I appreciate that, Sue. All right, so if there's no more questions, we will jump back into Mac's training account and run through a report very quickly. We're not going to keep you guys all day. All right. Let's see here. He said 391. All right, so this report's already been done and completed, but so we'll run through it and we'll save us a little bit of time here as far as going through the report. So this is what the, as you guys all know, since you guys are all on it, this is what the new NEMSIS 3 patient care report area looks like. Bigger buttons here on the left-hand side for use with a tablet, making it easier for the crews. When you first come in, it's going to take you to your response and crew page. You're going to have red warning sign just like that. And basically the goal, just like other areas in the system, is get everything to go to green so that when you get down to summary, you can authorize and send off to the state. All right, so we'll show here, oh, not that. If I unclick these, this is one of the areas where the our settings in the apparatus list are going to come into play. If I click at Medic 1, it's going to automatically select my primary role and level of care. Okay, so first EMS unit on scene, yes or no. And you also notice that, you know, if the red asterisk there means that it is required. So this is non-transport, I forget what he had it as. Non-transport rescue. Okay, so initial patient acuity, that's one of the new things, requiring the crew members to basically triage the patient before and after they get to their destination. So initial patient acuity is green for this patient. Your crew, so if I add myself in here, the other thing you'll notice is when I click on that down arrow there, it automatically takes me into the filter, so I can just go ahead and start typing. So it adds me in, and it should, must have messed with it. It should automatically do my cert level there when I select my name. Alabama requires role, so I was another. PPE, have lots of options for PPE as well as exposures. All right, delay types. So this is going to be your delay types within your patient care report. So I can pre-fill no delay for all of them. I can change it if I need to. Apparatus times is going to mirror my basic info 4 page, and we'll also edit it if you edit it here. So that is my response and crew page, and I'll jump into patient info.
Hey, real quick, Alan.
Yes, sir.
You'll go back to response and crew real quick on the certifications, just covering that certification section again. This is where when you have your certifications tied to those NEMSIS certifications, it'll auto-populate here. If you have it tied to a state certification or anything else, you'll have to select it. It won't auto-populate anything other than the NEMSIS certifications.
Thanks, Todd.
Yep.
Exactly correct. Okay, patient info. All right, so it's going to be looking for 3 things here when you are trying to do a frequent flyer: first and last name, birthday, first and last name, social security number, or first and last name, and driver's license number. So those are the three things it's going to be looking for to do a frequent flyer. And I'm not sure if I type this in again. Yeah, since he's already got it in there, it won't pop up again. But you'll get an update that'll pop up and say, do you want to use this frequent flyer? And it'll tell you how long ago that they were last on them. You click yes, and it'll pre-fill everything on this page, some on medical history, and get you off on the right foot for your patient care report.
It also populates medical billing information.
Yes, some medical billing. Yes, it'll populate their insurance, their method of payment, and their insurance information. Okay, patient's home address. So if this was a transport, let's see here. I'm going to guess that if I put in transport, it would require that information. Yep. So it's going to require patient's home address. I can hit pre-fill incident address if I choose to do that. It's also wanting to know the county there. It's loading the county list. Let's say that's in Mobile County. All right, you got medical documents where you can document living wills, DNRs, contact info, so phone, email address. Some states, I believe, do require contact info. I know that I believe it's Oregon, requires guardian information for patients who are under 18. So this is where you would enter in relative and guardian information. There was talk, I know that at FDIC we talked with an Oregon customer, Stuart, our product manager, and I talked to an Oregon customer about having a pre-fill from patient address button here. So hopefully that comes here in the future. And then we have employer info. So if it's an employer incident, an accident on the job site or something like that, you can enter in the employer info. Medical history. So as you can see, since, well, no, this was already done, that's why. If I did use a frequent flyer, it will pre-fill this information down to drug use and pregnancy. So we have where we got the history from, practitioners, allergies, environmental allergies, medical surgical history, immunizations, current medications, and we have drug and alcohol use indicators. Some states do require this. Then we have pregnancy. It does default to no for men. So for male, so you have possible unconfirmed, yes confirmed, all those different options there, as well as last oral intake. All right, so when we get to patient care, all right, so he had done an exam here, but because now I changed it to trade transport, it wants an initial assessment. So the things it's requiring here is symptom and impression, but we'll put in a complaint. So got a tummy ache. Anatomic location, organ system. So that's your complaint, your symptoms here. We'll do abdominal pelvic pain. Impressions. Let's go with digestive and say I got appendicitis. All right, so now I'm green. If I hit done, should make my patient care go green there. So that's initial assessment. So because it was required, it automatically went in there. But if I clicked here, it would create a new one. I'll create a new vital here. We'll say it was, we got to match the date here. So it's 04/19/2018 at 07, between 07:04 and 07:25. So we'll say 07:15. Say Brian, got it. We have pulse rate, blood pressure. So when I start typing in blood pressure, you'll notice that method becomes required. So I have to fill that out. Respiratory information, blood assessment, stroke, temperature, cardiac, AVPU, and your pain scale. I can hit set maximum for Glasgow Coma Scale. I can either use done or add another. And then we have exam. So it looks like Mac had already done an exam here. So all this stuff was pre-filled normal, but I'll show you again. If I hit pre-filled normal, it's going to tell me what it's pre-filling, and it talks about there that it will not replace values that are already selected. So I'm going to hit pre-fill. But like I said, let's say the mental status assessment is not normal. I passed it already. I can click on it, unclick, and say I'm sedated. So I can edit those as I need to. Procedure. I just won't save this. We'll go through here. If I select Brian, makes him an EMT, and then it's going to modify the selections down to what I chose within my settings. So I believe that I changed something. I can't remember what I changed, but you'll be able to see it here in medication. So procedure, and I'll go ahead and delete that out so we can get this done. Medication, so if I select Brian, makes him an EMT. Now when I go into, it must not have been Brian that, or the EMT that I changed. I was changing advanced EMT, wasn't I? All right, it's Thursday. So if I select advanced EMT here, let's go back here. Procedure, medication. I do medication. I must have selected them all again. Let's select a paramedic. Todd, do you remember which one I selected?
No, unfortunately, I wasn't paying attention. I was answering questions.
I normally know my account. Since I'm in Mac's account, I can't remember which one I narrowed down. But if I select one that's narrowed down, it's going to narrow down my medication so that I don't have to select or click through all of these to find it, or type through all of them to find it. And then when I choose medications that have been frequently given, which we'll have to see if Mac has some. There we go. Oxygen. It's going to bring up my frequent medication administrations. So this is going to pull from data that other PCRs have put in. So this isn't where you enter it in the administration or anything. It'll look at past times that oxygen was given and the ways that it was given, and will pull up with your frequent administrations. So then I can select 4 liters per minute via nasal cannula, and it'll pre-fill into my report there. Goodness. All right. So let's delete that out so we're good. All right, labs. So this is an area where I can submit labs. Forget this. This is just a little bug that for some reason it pops up just on labs. I can record labs that I'm doing in the field, or if I'm recording labs that a nursing home is giving me, I can do that. And then device here, I can record shocks, add files, whatever I need to do. I know I'm kind of breezing through here, but I know just because we don't have all day, we got about 10 minutes left. So if you do have specific questions, feel free to jump in there and ask, and either Todd will answer or hit me up with it and I can answer.
The only question I haven't been able to answer so far, Alan, is the frequent flyer. I told him once we got through this PCR, we just go back and start with a new patient. We could show them the actual frequent flyer that pops up.
Yeah, that's fine. I'll jump into my account because I know that I'm in there as me. So we'll do that. Thank you. All right, so event, it's going to default to not applicable. So I can, or excuse me, I think it defaults to unknown. So you can say yes or no. If I say yes, it's going to require more information to be filled out. As you can see, you go through here. If I select, I can select, what kind of accident it was or what caused the injury. Mechanism, trauma criteria. If it's a vehicle-related injury, fill out the vehicle information. And then same deal here with cardiac arrest. So if yes, prior to arrival, it's going to require a lot more information there below. Okay. Then we have work-related incident information as well as stroke symptoms resolved information as well on that page. I'll go back and hit no for injury. Destination. Like I said, final patient acuity, so I'll remain green. We'll say non-emergent from the scene since that's required. Other information I can select. And then we'll say ABC Hospital. And as you can see, destination county is required here. So when I hit ABC Hospital, it automatically goes ahead and puts in the county for me. So make sure that you put that in your EMS or your destination settings. Reason for choosing it. So we'll just say it was the closest facility. And now I'm green. But the other information you have, so if I did a pre-alert, I can do yes, a STEMI alert, and then I put in a date and time. Medical records information, and then a lot of NEMSIS information about, what happened after they were at the hospital, where did they go, how long were they there. A lot of information that you likely won't have, unfortunately. So that's destination. On to billing. Primary method of payment. So we'll say no insurance identified. I can record their specific insurance information if my department does that. Physician certification statement. Response and transportation. This is where, because I selected that it needed odometer readings, so I can put 12 and 13 in there, and it'll give me 1 mile. Or if I, want to just put in 0 and 1, I can record a mile that way as well. This is where medical billing district would come in, as well as up here, patient resides in service area, yes or no. So those are those. Supplies used. Unfortunately, that does not apply to our inventory module, but you can record the supplies that you're used on your call. Files and signatures. So just like other areas in the system, I can add in files here. Pictures, picture of monitor leads, whatever it may be. And then as you can see here, he's got a lot of forms here to fill out because he's been practicing with it. So we'll go through and sign them real quick. Oh, did I do something right? I didn't click other. There we go. Release for billing. And my refusal of treatment. All right, now that I got those done, I can go into my narrative. Mac's already completed his narrative, it looks like. So I can hit review requested, and this will allow the report to be searched from the advanced search field, potential airway registry patient, and then move on to summary, which is where I can go through and read through what my report and see validation results. So, as I mentioned, you can go through and do everything perfectly like you think, but Alabama has some very strict guidelines. So it says full Glasgow coma score with qualifiers should be recorded for at least one set of vital signs. So I didn't select a qualifier. So if I click that link, it's going to take me back here, and I can go down and do my qualifier. Not applicable. Now, at least that one validation result is taken care of. These links are new. Thank you, Sue. This is huge. So it's not for everything, but as they continue to work on it, everything will have a link, hopefully, so that if you do have a validation error result, like this, you can click on it and go back into the report and find where you need to take care of things. So it wants at least one procedure since the patient was treated, which is interesting. I don't know what I would do in Ohio because we quote unquote treat and transport a lot of patients without necessarily doing a procedure, just comfort, care, and empathy. So I don't know if empathy is listed in NEMSIS 3, but so there's once again state by state that is listed. These requirements are different. So Ohio, I can tell you that this wouldn't have popped up for Ohio, but for Alabama it does. So that's what you have to watch for, and this will help you take care of those. So Todd, what do we got here? Any questions? No, we're nearing the end. I'm rambling on.
I just got one. I'm just finishing up a reading. Brian has sent one in. Even after meeting all the requirements, all green check marks, authorized, being accepted by NEMSIS, as approved. Afterwards is the summary. We are getting state validation results with multiple warnings. I contacted the state and he said we are meeting the mandatory fields, but our validation scores are low, meaning recommended fields are not completed. Is there a way for us as end users to set up the PCR to identify those areas in the PCR so our crews know they should be completed? I'm assuming this is going to be state validations, and if you don't, Brian, if you don't have your state validations warning turned on, you won't get this validation results screen like you're seeing right now. That should identify all of your state requirements that are they're over and above the NEMSIS 3 requirements. Am I saying that correctly, Sue?
Okay, so there's a couple things going on. Every state is a little bit different, but those quality scores that some states have can be based on warnings, not just errors. So there's a place in admin where you can turn your warnings on or off. Most people have them off because they're just trying to get the bare minimum through so they can have their PCR accepted by the state. But if there's a quality issue, it can be because of warnings that aren't addressed. So you would probably want to turn your warnings on, and then you would see those in the validation results in addition to the errors. The errors are the things that are going to prevent you from submitting to the state successfully. The warnings are the nice to haves, but they can ding you in some states and your quality score.
Exactly. So like Sue said, because I have these validation errors here, as you can see, there's errors, I cannot click to authorize this report. If they were warnings, if they were just warnings, which I don't see any just warnings, if they were just warnings, I would be able to authorize it. So to answer your question, Brian, you will not be able to change the requirements of the PCR to make them, have a red asterisk, but you will be able to turn on the warnings so that when they get to this summary page, they can see that there's warnings and that they need to, complete different areas of the report. Hopefully that answers your question.
And like I said, Brian, if you'll reach out to me later this afternoon, I've got another meeting at 2:30. I should be done by 3:30. That's Central Time. But if you'll reach out to me, I'll be glad to jump into your account with you and see if we can figure out your certification issues and maybe this issue as well.
Yeah, and you turn on those warnings in your administration panel in the required fields and customizations. There's a checkbox for enable N3 state submission warnings.
Yep, right here. I'm going to jump into a patient care report here in my training account so that you can see the frequent flyer. So now when I add a new patient,
Again, 3 data points is what the system's looking for. First name, last name, and a date of birth. First name, last name, driver's license, or first name, last name, social security number. You get this.
so when I get those 3 in there, it's going to say, would you like to pre-fill this PCR with the existing data? So patient info, medical history, and billing. That's going to give me my name, birth, or gender and age, as well as the home address, which can be, could be correct or not correct. So if it's, if they've moved, you just got to make sure that you put those 3 data points in there correctly so that you are pulling in the correct information. So when I hit pre-fill this PCR, it pre-fills race, social security number, all that information. Then if I go to medical history, all that information is pre-filled as well.
And yes, Justin, that is correct. It will bring over your history, meds, allergies, anything that you have in the system for this patient. One of the nice things is, especially on frequent flyers, when you have lots of medications, you go in there and it'll bring over what was in there for the last treatment. You can make changes to those if there's dosage changes or maybe medicines added, some medicines taken away, but you can make changes and it'll hold it there for the next time you treat that frequent flyer.
Hey guys, I'm back. Brian, what state are you in?
Michigan.
In Michigan. Sue, has Michigan been turned on with the submissions yet?
Yes.
Okay, so he should be getting, he says he's not getting them until after the submission, so.
Oh, you mean the schematron for Michigan? Let me look at that.
Yeah.
Yep.
Yes,
And
Michigan is turned on.
Yeah, Brian, age does automatically calculate from the date of birth.
Do we have any other questions? We've reached our time frame, but I mean that's not it's not a hard cutoff. If we got more questions, we'll answer them.
Yeah, Brian, the age should calculate from when you put the date in there, it should come over. And you're saying yours is not. So again, Todd, I think is going to try to call you and try to walk through and see if.
Yeah, Brian, if you'll just send me an email with your contact information, and we'll get a meeting set up for later this afternoon.
All right.
All right.
Any other questions? Anybody? Well,
All right.
I'll turn it back over to Alan. As far as myself, I appreciate everybody today. Thank you for coming on, all the panelists and staff and attendees. Appreciate y'all. Alan, if you or Todd or Sue has anything else,
awesome. Yeah, I'll echo that. Sue, if you have anything to add, or Todd, obviously, or Lindsey, if Lindsey's still listening. If you guys have anything to add, but I appreciate everybody's time for coming out today. And like I said, if you have not had your NEMSIS 3 training yet, and you have some more questions or need some help, definitely reach out and we'll get that scheduled for you. But as far as today, I think that's everything we've got to cover.
Yeah. Don't forget, if you need it, there is a NEMSIS 3 setup guide in the handouts for today's meeting.
Yes, thank you. All right.
Great. Thank you all.
Appreciate everybody's time.
Everyone be safe. Have a great day.